Welcome to a special episode of Beyond the Roundup. Today we'll be discussing the new sweeping vaccine mandates from President Biden that is showcasing an unprecedented use of federal powers in this modern era. And so, from Trial Site News, I'm Adrian, and our episode starts now. So the Biden administration has doubled down on mandates and other measures based on the premise that pandemic eradication can be accomplished through mass vaccination. And now the president is using his formidable executive powers for sweeping federal vaccine requirements impacting up to 100 million Americans. Now, in a hostile tone to the 80 million Americans currently unvaccinated, President Biden has declared that this is a pandemic of the unvaccinated. This despite the fact that vaccinated individuals are also passing the virus. And so, the President of the United States has introduced a mandate that all employers with over 100 workers must require their workers to be vaccinated or test weekly for the virus. Moreover, about 17 million healthcare workers that receive federal Medicare or Medicaid must now submit to the vaccine. Additionally, executive branch employees or contractors will also need to submit to a vaccine with no option to test out, covering an additional 7 million in the workforce. Now, in this executive order, President Biden will mandate COVID-19 vaccination of all staff within Medicare and Medicaid certified facilities in a bid to both protect themselves and patients from SARS-CoV-2 and Delta variants. It is now a matter of federal regulatory compliance. Get staff vaccinated or fall out of compliance with executive orders. And so, with the executive edict in motion, the U.S. Health and Human Service Centers for Medicare and Medicaid Services, in partnership with the Centers for Disease Control and Prevention, or the CDC, are promulgating emergency rules mandating the expansion of vaccinations for nursing home workers, which includes hospitals, dialysis facilities, ambulatory surgical facilities, home health organizations, and other organizations in the federal ecosystem. Now, if they don't comply, then they will be cut from Medicare and Medicaid, both of which cover nearly 120 million people. Meanwhile, nursing homes are already facing severe shortages in workers, and with a vaccination rate of over 70%, with at least one dose of the vaccine for those over 65, the elderly nonetheless are purportedly experiencing higher rates of SARS-CoV-2 infections that these rules are meant to prevent. Now, these new rules could also put this age group at greater risk, as a potential byproduct of this new government direction and control could be even fewer facilities available. Now, proponents of this move by President Biden point to the rationale of preventing a rapidly spreading virus during a public health emergency. And with the PrEP Act already establishing an ongoing emergency since last year, many Washington insiders will not see this move as too far a stretch. However, the backlash has been severe and swift, and even our founder at Trial Site News, Daniel O'Connor, wrote about this new move, saying that what is now unfolding represents an unprecedented mobilization of federal power into the deepest, most intimate levels of society, the economy and communities, and well-intentioned, goes contrary to the ethos and spirit of the American system. There is any number of reasons why vaccine hesitancy exists, from significant legacy racism manifested in human experimentation on African Americans a few decades ago, to a significant concern about vaccine side effects, to religious or other personal reasons. Now, while undoubtedly the President of the United States' intentions are to overcome this pandemic, and that is understandable, there are so many data points that the public health authorities are not recognizing. For example, the current vaccine that has been approved does not translate to the product liability American consumers are accustomed to. The PrEP Act shields all the economic actors. Moreover, the effectiveness wanes within 4 to 5 months. Does this set up forced boosters every 6 months? The rule of law as we know it in many ways has been superseded by apex executive powers that could produce unanticipated, perverse, and paradoxical outcomes that no one cares for. Now, Trial Site News has chronicled growing breakthrough infections among the population, meaning that even vaccinated people are not protected from Delta, and the vaccinated themselves can help spread the virus to others. The British Medical Journal, or the BMJ, recently reported that significant numbers of hospitalizations and deaths in the UK are now in vaccinated people. In fact, this piece cites Public Health England saying that more vaccinated people are dying of the Delta variant of COVID than the unvaccinated. According to this recent report, 65.9% of people who died from the Delta variant within 28 days of a positive COVID test between February 1st of 2021 and August 2nd of 2021 had received at least one dose of the vaccine. The BMJ reported that 54.1% had received both doses. Now, is this an alarming set of numbers? Absolutely it is. Yet, the BMJ plays it down, declaring that with an imperfect vaccine and high vaccination coverage, it is exactly what we would expect. Meanwhile, in Israel, they are now moving rapidly through its third booster. And while Herzog Hospital reported to Trial Site News that the jabs are helping protect vulnerable populations, such as the elderly, there is now already talk of a fourth booster. This level of intense vaccination just isn't normal and indicates problems with the underlying vaccine. Now, the bigger winner here with this latest declaration from the President of the United States is Pfizer. With absolutely no liability and already an unprecedented $33 billion in projected money in the bag, it is heaven on earth for their shareholders. But for people that, for whatever reason, opt not to accept this early-stage vaccine, this could quickly become hell. And so, the yin and the yang of life are at play here. For every desperate move to beat Mother Nature, or possibly a gain-of-function created version, through brute force, eradication via vaccination of a dangerous and dynamic pathogen, comes unintended and often unexpected consequences. And in this case, there will be a heavy, perhaps unprecedented price to pay. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining us on our program today. From Trial Site News, I'm Adrian, and I will see you all next time.